Welcome to Docs on Call, brought to you by Fort Wayne Endocrinology.
Good evening. Thanks for joining us tonight. I'm Lee Kelso. Glad to have you back for another edition of Docs on Call. Tonight, a guest we've not seen before on the program, Dr. Ashok Kadambi. He is a specialist in multiple endocrine issues, and we're here to talk about the myths and the facts of hormone replacement therapy. And it's not just for women. Men are also on the table here tonight, so we'll be talking about some testosterone issues for you. This is an area that I think you're going to find very interesting, so I hope you'll join us with phone calls at 483-8331, 483-8331. Welcome, Dr. Kadambi. Nice to meet you.
Well, thank you, Lee, for the kind introduction.
Well, let's start with the discussion around aging and hormones. What role do hormones play in our aging process?
Okay, Lee, let me first off make a disclaimer here. Nothing that we know of, nothing can reverse the process of aging. So that's the first myth I want to bust, that there's no such thing as anti-aging. It doesn't exist, okay? We all are going to age. We all age at the same rate, 1 year at a time. Okay? However, what hormones can do, what hormone optimization can do for you, is it can sort of prevent some of the bad effects or the side effects that we normally associate with the aging process, or diseases that we normally see with the aging process, such as heart disease, Alzheimer's, osteoporosis, or bone loss, things of that nature, or general frailty and things of that nature.
Well, that's pretty dramatic. I don't know if you heard that, but so you think that optimum hormone therapy can have a big impact on all those conditions, heart disease, diabetes, Alzheimer's. That's pretty remarkable.
Absolutely.
So tell me about that phrase, optimum hormone levels. How is that different from normal hormone levels?
Yeah. Well, the normal hormone levels are usually such a wide range. I'll give you the example of, say, for example, testosterone. The normal level for male testosterone is 300 nanograms per ml to 1,000. It's a big wide range, give or take a few depending on the lab. If you come to me with symptoms and you have a level of 302, okay, just above the lower limit of normal, you're technically still in the normal range, but you may have a host of other symptoms that are associated with low testosterone or low T. In that case, you need to be treated because that so-called lab normal is not optimal for you. So your normal is different from the lab normal, and that's part of the art of medicine. It's up to the doctor to figure out which ones to treat and which ones to ignore.
So is that also part of the failing of traditional medicine, that we treat to normal instead of paying attention to what's best and optimal?
I don't think it's a failing of traditional or standard medical practice. It's just that we as doctors have been trained to treat diseases when they happen. We have not been trained really to prevent diseases because that's not been our focus during our medical training. So we are very ill-equipped in the preventive aspect. Our extent of preventive care is to do pap smears and mammograms, and that's about it. But real preventive medicine should be how to prevent the pap smear from getting abnormal or the mammogram from getting abnormal in the very first place. That we don't do very well. That we have to really have to work at that. We really need to educate the doctors on how to do these things.
Very good. Well, that's part of what we're here today, is to educate you about the concept of hormone replacement therapy, which I know has sounded kind of scary to some people from time to time. There's been a number of studies that indicate there are some risks involved, but that comes down to the type of hormones being used, right?
Absolutely right. There are hormones and there are hormones. Okay, the biggest difference between the bioidentical hormones and the non-bioidentical hormones is that the bioidentical hormones is an exact match or an exact replica of your own hormone that you produce. So, for example, if in a woman, for example, if you take something like progesterone, okay, that is the bioidentical hormone. Okay, and if you take Provera, which is the synthetic counterpart, it's a very different hormone. In fact, they both start with the letter P, but the resemblance sort of ends there. Okay, if you can have slide number 1, I can just show you what I mean. If they can project that up, yeah, there you go. On top is what you see is a molecule of progesterone, nice and clean. You know, the steroid nucleus in the middle. Okay, by the way, most of these hormones are derived from cholesterol, which is the starting point, or that's the starting point for manufacturing these hormones in the body. And that's why you see the central ring, those 4 rings in the middle, okay? And then on the side chain, if you focus your attention to the top right-hand corner of those molecules, you see that's the subtle difference. It's exactly the same except for the side chain on the top right-hand corner. That's where the distinction, that's the distinction between a synthetic hormone and a natural hormone. On top is the natural progesterone, which is what a female would make after ovulation. At the bottom is medroxyprogesterone acetate, or Provera, which is the synthetic counterpart of the progesterone. In fact, they use progesterone to make the Provera, which sort of boggles the mind. Why mess with a good thing, you know?
Well, because you can patent it and sell it at a higher
probably
price, right?
That's economics for you,
Yeah.
101. Okay, that's what happens sometimes.
But that's a key element here. That's a key differentiator, is that this, we're talking about bioidentical. They are hormone supplements that are identical to what your body produces and not a synthetic product.
Yeah, absolutely correct. The synthetic products are ones that have been biologically altered. So the better terminology would be bioidentical versus non-bioidentical, because sometimes if you use the word natural, they may say, oh, okay, I got this product called Premarin, it's made from horses, it must be natural. No, it's not. It's natural for the horse. It's not natural for you. Okay.
Right.
By the way, the hormone in question was Premarin. It's made from the mares or pregnant mares' urine or urine of pregnant horses. That's an estrogen. Is part of estrogen replacement therapy, but the bioidentical component would be estradiol, which would be the safer way to go, because Premarin has its own set of problems.
So when you're talking about these natural hormones, these are not products that I'm buying at a health food shop. These are not natural products that we've come to sometimes suspect.
Right. These are prescription products. The doctor has to write a prescription for these bioidentical hormones. They're not over the counter. Over the counter, they don't have much estrogenic activity. They have very poor estrogenic activity.
We have callers on the line.
Oh, you have
we have
already?
Susan,
Wow.
James, Peggy, Barbie, lots of callers. I have just a couple more questions I want to get through, and then we'll start taking your calls.
Sure.
So please stick with us for just a second. So you check my levels of what is normal for me through a blood test.
Correct.
And you have your own lab where you test these.
Yeah, we have a standard endocrine lab that we actually test these hormones, and we then sit down and discuss the levels with you.
Mm-hmm.
And if we find that, for example, if you complain to me of fatigue, tiredness, decreased memory, concentration, and I found your testosterone level to be 305, and the lab range reports normal as 300 to 1,000, I'm going to say, Lee, you know what, lab levels look normal, but you have all the symptoms of low T. This may be not optimal for you. So let's try you on a little bit of bioidentical testosterone cream. Let's try it for a couple of months and see what happens, and we'll check your levels again. If the levels go up and you start to feel better, then we'll make a diagnosis of hypogonadism and keep you there and treat you with testosterone.
And the treatments for conditions can range from, we just talked about low T, but also I know menopause symptoms can be treated very successfully.
Similarly,
what else?
We can treat menopause. We can, what we talked about was andropause in male, menopause in females. Then, of course, hypothyroidism in both men and women. Okay, controversial, but growth hormone deficiency in adults. And that has to be obviously extensively tested. We do not advocate giving growth hormone for any other reason except for treating a deficiency state, which is the way it ought to be. Then, of course, vitamin D deficiency, because vitamin D is also now considered a hormone more than it is a vitamin. It's discovered as a vitamin, but it functions more like a hormone. So these are some of the things we do. Then there are the other minor things like melatonin and DHEA. We also replace those for things like adrenal fatigue and insomnia and things like that.
Well, I have many more questions, but the program is about you. So thank you for everybody who's jumped on the phones at 483-8331. We're going to take our first question tonight. Looks like Peggy, you have been on hold the longest, so you'll be our first caller. What is your question tonight for Dr. Kadambi?
I'm so glad you're on tonight, doctor. It's good to see you. I have several. I'm going to try and make this quick.
Thank you.
I have several problems: menopause, thyroid. And I'm taking a cream that you just mentioned. Should I switch, and should I see a doctor like you as opposed to a general practitioner?
That's kind of a loaded question. Should I see a doctor like me rather than a general practitioner? Many of the general practitioners really know what they're doing because they are doing the bioidentical hormone replacement properly, in my opinion. They're monitoring blood levels, they're monitoring the patient's symptoms, and they're actually really good at what they do. So the answer would be depends on the general practitioner. If you're happy with the general practitioner and you're getting good results, fine, stay with your general practitioner because that's probably the most cost-effective way to do it. If you're not happy, if you need a second opinion, you have every right as an American citizen to seek any second opinion you want. Either you can see me or you can see doctors that I have trained, The list is too long to mention. You can call my office. They'll tell you all the doctors that have trained in the community and beyond, and you can choose any one of them. It's really up to you. We don't take all insurance plans, but that's the way it is. Nobody can participate in everything. But my feeling is that if you're happy with your GP, please stay with your general practitioner.
Peggy, what symptoms are not being effectively treated right now?
And about the cream, should I switch?
Only if your symptoms are not being treated and if your blood levels are not adequate.
Okay, I think what I'll do, doctor, is I will make an appointment with your call and that way I can let you go.
All right, Peggy, thank you for your call. We're going to roll ahead to Barbie and your question for us tonight. Barbie, go right ahead.
Hi. I'm just surprised I'm on and I can get some help. They have Premarin advertised, if I'm saying it right, the cream, the vaginal cream. Mm-hmm. That's a cream. When I was younger, before I got into, menopause, they had me on a pill with Premarin and the other pill that you take one for a whole month, you take one for just 2 weeks. And they're hormones. And my doctor said, okay, you've been on them long enough. Just don't take any more, because there was all the side effect problems going on with people.
So you're still having menopause problems today, Barbie?
Well, my problem today is I wanted to ask, is it safe to use that cream down there? Because that's also what's the word? What you're talking about, the stuff.
If you're talking about the bioidentical hormones, and if your doctor is monitoring your blood levels and your clinical symptoms, it's probably safe to use it indefinitely. But I don't know, I couldn't precisely hear what you said towards the end. Was it Premarin or something like that, or Prempro?
Yeah,
I wouldn't use the synthetics indefinitely. I would definitely talk to your doctor about switching you to the bioidenticals if you plan on staying on it long term.
Well, I'm an old lady already. I'm 70 in November.
Okay.
And I don't know if that made a difference.
Well, age is no criteria. Are you a good 70 or are you 70 going on 90?
Oh,
are you 70 going on 60?
I feel some days like I'm 18.
Okay,
other days
then you probably
like
need
I'm
it.
90.
Yeah, you then probably be okay taking the bioidentical hormones. But make sure that the hormones are bioidentical and not Premarin or Prempro.
Thank you, Barbie. We're going to move ahead to James and your question tonight. James, go right ahead.
Yes. Can you hear me?
Yeah.
Okay. Yes, I've reached the age. I enjoy you guys' program here. This is pretty interesting. I just reached the age of 52, and I have a high blood pressure, and I'm on the medication, the lisinopril. And so here's the thing. My question is, I guess I have an inclination that this could be probably a low T thing that I'm going through right now, or male menopause or something other.
Why do you say that?
Well, it's just I'm not as active physically. And then I was wondering, my question is there like maybe I just heard you say something about what's the name of it, hormone supplement that may not cause an issue with the high blood pressure pills that I may be on, or like may have some type of side effects or conflict or anything. Is there anything that you would suggest?
So the question is, do I have low T or not, correct?
Yes.
Well, first of all, you're other side of 50, so welcome to the club, okay? Sometimes not so good things happen the other side of the border. But I can tell you one thing, that you really need a hormone screening. You need to not only look at low T, you need to look at your vitamin D levels, you need to be screened for pre-diabetes, all of those things. Because any one of those things, there's a lot of overlap between all the symptoms. A lot of these hormone deficiency have very common symptoms.
So James, did I understand that you're now taking some type of a low T product? Are you being treated?
No, not yet. I just it was something that I'm considering.
Okay, gotcha.
Yeah.
And so those products that I see advertised for low T on television, those are the synthetic hormones, correct?
Yes, those are the synthetic hormones. They're basically pharmaceutical products, and they're very expensive. And a month's supply can cost as much as $400 or $500 at retail.
Goodness.
Considering that insurance will not cover it, because if you're on the low end of the normal range and you have all the symptoms of andropause, it still won't cover it because you're not in the low range. However, with the compounded product, you can expect to pay somewhere between $1 to $2 a day, which is not that bad, as opposed to $5 to $10 a day for a pharmaceutical-based product.
Well, my goodness,
So-
no wonder you don't see advertisements on television for bioidenticals.
There is bioidentical. Unfortunately, they have got a very poor lobby because it can't be patented, so nobody really wants to advertise it. It's sort of like an orphan. But practitioners like me who are in the know vigorously promote it because of all the health benefits that they confer.
You bet. Everybody who's on the line, please stay right there with us. If you are joining us late, this is Docs on Call. Our guest tonight is Dr. Ashok Kadambi, a specialist in multiple endocrine issues. We're here tonight talking about some of the myths and facts around hormone replacement therapy for both men and women, the importance of having not just normal hormone levels, but optimal hormone levels, and making sure those hormones are bioidentical and not synthetic. So that's the basis of our program tonight. We're going to jump right back out to the phone. Stacy, you've been holding a while. What's your question for the doctor tonight?
Hello, my question is regarding my husband.
Mm-hmm.
He has a heart defibrillator, and we've had him on testosterone in the past, and his defibrillator always went off. I'd like to hear his opinion on what it is that's causing that, how he can explain that.
Okay, that's a very interesting symptom that, from what I understand, your husband, when he took the testosterone, had his defibrillator go off. Is that right?
I believe I heard her to say when he did not take the testosterone.
Oh, when he did not take the testosterone.
No, when he was.
When he was
When he was
taking
He was
on
on
it.
the
Okay.
testosterone patch,
Patch,
and
okay.
he ended up in the hospital several times, every time he was on the patch.
Okay.
Yeah. This is the first time I'm hearing something like this, but I suppose in life anything is possible. But in general, the testosterone is very heart friendly. It will actually help the heart function better. It improves the pump function
No,
of
it's
the heart.
actually not. My husband's a patient of yours.
Right. So obviously it didn't work for your husband, and he should not use the testosterone. But I have never heard of anything like this before. Yeah, but
I
then
just think that you're
just
people.
because I haven't heard of it doesn't mean it doesn't exist. So I would just stay away from it for now.
Stacy, thanks for your call tonight. We're going to roll ahead to Stephanie. Stephanie, and your question tonight for Dr. Kadambi. Go right ahead.
Yes. Are bioidentical hormones superior to the synthetic hormones, and are there any studies to support this?
Yes, there's actually a big review by Dr. Holtoff, Kent Holtoff. He did a review in 2009 in a journal publication called Postgraduate Medicine, and he has about 196 cited references. And his conclusion was that all the studies, all the science, all the data behind bioidentical hormones supports the conclusion that they are far better and far safer and more efficacious than their synthetic counterparts. Now, this is not controlled randomized studies. He also makes a disclaimer saying that there are no controlled randomized studies comparing bioidenticals with non-bioidenticals, except for very few of them. But the few studies that are there show a different superiority of the bioidenticals over the synthetics.
Well, let's move on to Teresa, who has a question about bioidenticals. Go right ahead, Teresa.
I've actually been on the testosterone bioidentical hormones for about 3 months through my nurse practitioner.
Mm-hmm.
I had just didn't feel right and was tired and very anxious, and also was having problems with anorgasmia, I guess this would be the word.
Mm-hmm.
And since I've been on that, it's just been such an amazing change.
Good.
Good.
I think if anybody out there that I'm 45, I just turned 45, is questioning using it and wondering if it's for them, go to your doctor, get your, hormones, sorry, my dog, hormones checked out, and definitely consider it. Also, I want to know, how long is it safely, how long can you stay on it?
How long do you want to stay on it?
I want to keep feeling good and I want to have
Okay.
energy. And
Oh, stay on it. Stay on it
keep having
indefinitely.
sex
There is
life,
no,
so-
there's no cutoff. There's no magic age at which you stop taking stuff. As long as you feel good on it, as long as there's no side effects, it's not causing you harm, somebody's a practitioner, or a nurse practitioner, or doctor monitoring your levels, you're okay to stay on it.
Now, Teresa, I heard you mention you're taking testosterone, right?
Yeah, and I use, they started me out, it's compounded and it's done through a Fort Wayne RS. And they started me at 2.5, and then it was too much. It made my menstrual cycle short, and I was getting kind of agitated. So then I had my blood level redrawn. That's the thing with it. You have to get,
We're audio. Your phone is kind of breaking up there, Teresa. We're going to move along, but let me ask the question to Dr. Kadambi. Is it unusual to see a woman taking testosterone supplements?
Not very unusual, especially a woman who's had total hysterectomy with removal of the ovaries. Because remember, when you do a total hysterectomy, you remove the source of testosterone for the woman. Testosterone is both a male as well as a female hormone. It's another one of those myths that testosterone is a male hormone. The fact is that it's both a male and a female hormone in different proportions.
Lisa, you're up next on our program tonight. Go right ahead with your question.
Hello. I have the last 3 years, I'm 40 now, at 37, after my blood was taken and, my hormone levels, everything were checked. I have went through complete menopause, is what they're saying, completely through it at age 40 already.
Okay.
So, that was kind of a hard thing to deal with in general. But the thing about that is I don't know if I want to use the word allergic, but I've never been able to take birth control. And whenever I asked to be put on a hormone or, to kind of figure out what could help me through this whole process, they told me that if I couldn't take birth control, that I better not try any kind of hormones, because birth control is a hormone, which I didn't really know that to begin with. But I guess my question is, there's nobody ever gives me a real reason why at 37 I went through complete menopause. So, just I want to feel better. I lack energy. There's, slight mood swings.
I think we've got it. We're short on time, so I want to move ahead and get the doctor's response, if you don't mind, Lisa.
Yeah. I think, you see, the question, Lisa, you have is why did I go through menopause this early? There is a condition called premature menopause that can happen because of something called autoimmune ovarian failure, which is most likely what happened in your case. And secondly, just because you couldn't take the birth control pill does not mean you cannot take the bioidentical creams or bioidentical hormones. Remember, birth control pills are not bioidentical, they're synthetics. So if you couldn't take the synthetics, you can certainly take the bioidenticals. How do I know you can take the bioidenticals? Because when you had your ovaries functioning, you weren't allergic to your own hormones, were you? So bioidenticals is just that. It's your own hormones giving it back to you.
So now she's postmenopause, and feeling
lousy, for lack of a better word.
Right.
And she needs hormone therapy. If she doesn't get hormone therapy, not only is she going to feel lousy, she puts herself at risk for heart disease, osteoporosis, Alzheimer's, and just generally feeling lousy.
We have, it looks like another Lisa on the line with a question about thyroid. Go ahead, Lisa.
Yes, I was wondering, I took the pills to get my thyroid destroyed. And then I'm on the Synthron now. And my question is, can you ever get off this medicine?
Synthroid, probably.
Yes. Can you ever stop taking the medicine is my question.
Yeah.
It's like,
what's the question again? I'm sorry, I didn't get it.
Can she ever?
Yeah, it's not doing me any. It's like it's doing worse for me. It's not doing any good. I can't get sleep.
Okay. There are a couple of reasons why a patient will not respond to Synthroid or T4 or levothyroxine replacement. One is that you probably need another type of thyroid called T3, okay, and that's not being replaced. Number two, there may be other hormonal issues besides the thyroid that may be causing your symptoms. Because remember, deficiency of hormones, most of them cause fatigue as a symptom. Okay, so it's hard to tell whether it's thyroid or it's estrogen, progesterone, growth hormone, what have you. There's so many nuances to this. So you'll have to have a full hormone screen, and then we'll be able to determine.
And what is that full hormone screen? Is it simply just a blood test?
Yes, it's for the most part it's a blood test, and sometimes we do a urine test. But the blood test, we basically look at the pituitary gland, the thyroid gland, the adrenal glands, and the metabolic parameters like insulin levels, etc., to see if there's any imbalance. And then we go ahead and correct the imbalance.
Sarah, you're up next on our program this evening. Go right ahead with your question.
Hi, Dr. Kadabi. I am actually a patient of yours.
Oh, welcome to the show, Sarah.
Yeah, I am in my first pregnancy, and I have hypothyroidism. And I've been reading articles online that hypothyroidism can cause or be contributed to children having mental disabilities and developmental delays. I was just wondering your thoughts on that.
Yes, if it can happen. Remember, some of the mother's thyroid crosses over the placenta and goes to the fetus. So if the mother doesn't have enough thyroid, it is a theoretical possibility that the infant's, the unborn child's brain may not develop properly. In the extreme form, of course, severe hypothyroidism can cause terrible things in the fetus, can be born with mental retardation, all that. But in a more subtle form, maybe learning disabilities. Nobody has really completely linked to it, but there's a suspicion that it might. So what we tell our patients is, if you're pregnant and you are taking thyroid, we like to increase the dose of your thyroid. So we raise the dose of thyroid in the mother so that the baby gets enough thyroid.
We have to leave it there. I'm sure that we didn't get to touch on diabetes and some other conditions, so we hope that you'll come back and we can have another program and answer more questions. Lots of phone calls tonight. Very good questions. Thank you very much. I hope you've enjoyed our guest tonight, Dr. Ashok Kadambi with Fort Wayne Endocrinology. You can contact him at 436-1248 or visit the website right there on your screen, fwendo.com, FTW, thank you, ftwendo.com. That's ftwendo.com. It's on the screen and I couldn't read it. Maybe it's time for me to get that T checked. Next time on the program, Docs on Call will be with you, and Ted Blanford from Summit Hearing Solutions will be here answering your questions about the latest in hearing technology and what makes hearing so important to your life and your family. You can watch Docs on Call online anytime you like. Just go to INC Now or 21alive.com. Go to the features page and click on Docs on Call. Thanks for joining us tonight. Have a good evening.